Hi, everyone. This is Jenny Johnson with CHP Healing Hearts, and I'm really excited today to talk to you about our webinar on feeding. As you know, babies with congenital heart disease can have a lot of feeding difficulties, and that is one of the topics that parents have asked us to talk about today. So I have three of our cardiology staff here at the Children's Hospital of Pittsburgh who are going to talk to you about breastfeeding, the benefits of breastfeeding, and the many resources here at Children's Hospital about breastfeeding. And we'll also talk to one of our occupational therapists who is going to talk to you about the different things you can do for your child while they're in the hospital working on their feeding skills. So I couldn't be more excited. First of all, we're going to start with Jessica Davis, who's one of our ICU nurses who just did her PhD and is a lactation consultant as well. And Nicolette is one of our 7A nurses who is doing one of our breastfeeding projects for our fetal parents as well. So I will let them take over and go from there.
Right. Hi, everyone. Thank you for participating in this webinar. I'm Jessica. And as Jenny said, I'm a CICU nurse at Children's Hospital, and I'm also in the throes of the PhD program at the University of Pittsburgh. And then Nicolette is here with me to help me with the presentation. She is an almost lactation consultant and currently a certified breastfeeding counselor. So in a nutshell, human milk is life-saving for babies with congenital heart defects as well as for their families. I'm sure you've heard by now all the benefits of breastfeeding and chest feeding and providing your milk. And it's something that we really encourage and support here at UPMC Children's Hospital. One of the biggest benefits of providing milk is that it's something that moms can do themselves. You know, there's a lot of care that involves these heart babies that nurses are doing and physicians are doing, and sometimes mommies do just feel a little helpless and a little lost, but this is one thing that only you can do for your baby. In terms of benefits for baby, it's very easy to digest. There's lots of anti-germ fighting properties of human milk, and babies do tend to grow really well on human milk as well. In terms of preparing prenatally for chest or breastfeeding and expressing your milk, you want to first start by looking up some really good, credible resources on how to provide milk and how to provide milk for a sick baby. Nicolette is going to be one of your really, really good resources. She has a prenatal breastfeeding program that she'll discuss in a little bit more detail. But other sources include sites like Kelly Mom, where it's all evidence-based recommendations on breastfeeding, and it's peer-reviewed information. I always caution parents against following mommy blogs about breastfeeding and things like that, because there are some things that are very, very specific to sick heart babies versus babies that don't have heart defects and are at home. The other thing you can do is start getting comfortable handling your own breasts. Breastfeeding and pumping oftentimes is not something that a lot of people are super comfortable doing right off the gate, especially when you're coping with all the stress of having a sick baby that's whisked away from you. And so even if it's something as simple as doing a little bit of hand massage or hand expression during pregnancy, getting comfortable wearing nursing bras and unclipping them and clipping them back together, that might be something that can just make you feel a little bit more comfortable with yourself as you're moving into this new body and this new chapter of your life. To kind of segue into bras and from bras, you do want to buy comfortable and supportive bras without underwires. A lot of parents have also found the benefit of hands-free pumping bras that you can use while you're in the hospital. And some parents also feel more comfortable purchasing breastfeeding covers to wear while they're pumping in the hospital rooms as well. And then you also want to ensure that you have access to a double electric breast pump. Most insurance companies do provide new pumps with each pregnancy. There have been a couple recent changes in the last few years, so you just have to double check with your own insurance company. But the biggest thing to remember is double electric breast pump. Sometimes those wearable pumps don't always extract milk in the same way as something that has a dual motor, a powerful motor, and the pump really does matter in terms of milk expression and success. Anything that you want to add about your program here, Nicolette?
I think maybe at the end, I was just going to just add on, I know like if you have previously had a recent pregnancy, sometimes the insurances will give you a little bit of an issue getting one with, I think it's one every 2 years.
Okay.
And there's nothing wrong with, you know, using your pump from a previously pregnancy, just purchasing all of new pump parts and sterilizing those before you're starting. And then we also offer some pump rental options as well through the hospital. So that's something that you can look into once your baby is admitted and you are here with them.
Okay, thank you. Okay, so, and as we're talking about equipment, these are just a couple examples up here of the different types of breast pumps that insurance offers. So Medela is a pretty common one, and Children's Hospital has Medela pump products. However, they are different from this. So this is a single use, single parent breast pump, whereas the breast pumps that we have in the hospital are used for multiple people, and so they're shaped a little bit differently. The motors are a little bit more powerful, but this still counts as a double electric breast pump. This is a Spectra here. This one was my personal favorite as a mom. And this one has the added benefit of being a closed system pump, which means there's less likelihood of bacterial contamination. Whereas like something like this, the tubing connects directly to this face here, and that might run a little issue of maybe something creeping up or down the tubing that you don't want in your milk. This example here is a hand pump. I usually recommend that parents do purchase a hand pump just to keep in their bag in their car, just in case they have a long trip from home to the hospital and they get stuck in traffic and breasts get engorged, or even to take with you when you're in labor if for whatever reason the birth hospital can't get you a pump right away after birth. These are just, again, examples of supplies. As Nicolette was talking about, we will provide all the supplies to you for our Medela pumps. And then this is a nipple shield, excuse me, which will be available in the hospital. I am going to start coughing. Nicolette, would you mind taking over?
Sure. Okay, so immediately after birth, to initiate this pumping in your supply, you want to pump early and often. The first 48 hours after birth are crucial for milk establishment. We know that this is like a super stressful and unknown time for you as a mom, but if your baby was heart healthy and coming with you directly after birth, your goal is to breastfeed or chest feed or latch within the first hour. So starting pumping and expressing, whether that be by hand or by electric pump, within the first hour is really the goal. And then you want to be pumping every 2 to 3 hours for at least 15 minutes. And that is to really establish a good supply for yourself. Even small amounts of milk, so those first couple of days that you pump, you're only going to get very small volumes. Unfortunately, the bottles that they give you to pump in are going to look huge compared to the volumes that you're pumping. But save even the smallest amounts, because we can use those for oral care and passy dips, even if your baby is not eating. So that is what we call the liquid gold. So do not get rid of any of that. So for maintaining your milk supply, for that first month postpartum, you want to be pumping every 2 to 3 hours, even overnight. And we say at least 15 minutes, but if you are still getting a good amount of milk at that 15-minute mark, you actually want to keep pumping about 2 to 3 minutes after seeing the last drop. And then also maintaining your supply skin to skin care has many benefits for parents and babies. So we really focus on getting your baby stabilized and getting them into a good position once you are able to come over to the hospital to be doing skin to skin with you. Do you want me to keep going, Jess?
No,
Okay.
I'll go. Sorry.
No
COVID is in my household and everybody is recovering.
Oh, no.
So transitioning to direct chest and breastfeeding, that is also something that we can support you with while you're in the hospital. I always kind of just put in a little plug that breastfeeding, while it may be harder, more difficult for providers to kind of quantify, measure how much is going in and out of the baby. Physiologically, it's less stressful for babies to breastfeed than bottle feed. So there is a benefit of direct breastfeeding that does benefit your baby beyond just the contents of what's in the milk. The act of breastfeeding is the norm for babies. That's how we evolved, and so it can have some real good benefits for both you and the baby. It may just take a little bit of time. Every kiddo is different. Even with bottle feeding, some kids fly with the bottle, and other kids have a hard time. And so it's really about what your goals are. If you're interested in direct breastfeeding, say something and we'll be there to support you. And then how can partners and families help? So this is the big one. Feeding seems to be a pretty popular want among support persons, and that they want to be part of feeding the baby. However, as we said before, providing milk is something that only the mom can do, only the lactating parent can do. And so the way that you support this baby being fed is by supporting the mom or the lactating parent. So first and foremost, you need to educate yourselves. If your partner is seeking out breastfeeding and milk expression information, you need to be a part of that. You can be an extra set of hands, whether or not that means getting the parent water, getting them food. Crowd control is a big one. A lot of times, especially first-time parents, are really hesitant to, start pumping. If somebody else is in the room, they want those people to have an opportunity to see or hold the baby. It may not be as much of an issue now with crowd control in the hospital after COVID, because there are some different visitation guidelines, but really prioritizing the parent's ability to pump in a quiet, comfortable space and spend time with the baby is something that the support people can do. And as I said before, make sure mom or lactating parent is eating, drinking, resting, and taking her pain medication or their pain medication as needed. Resources at Children's, we actually now have 3 full-time IBCLCs, so 3 full-time lactation consultants. They're housed in the NICU, but they will come and see cardiac babies in the CICU. And then there's me and Nicolette. Nicolette's there on weekends. And then I'm floating around like 2 to 3 times a week and tend to pop in and see the breastfeeding moms when I'm there. We have double electric breast pumps to use at the bedside, as well as some available to rent. And then lanolin, breast pads, nipple shields, all the supplies that you would need are available at Children's Hospital. And then this is a list of additional resources that are all evidence-based and fact-checked. And then the phone number for the lactation consultants at Children's Hospital. And then just to put in my own little plug, as I said, I am a PhD student at the University of Pittsburgh. I'm currently recruiting participants for a small microbiome study, collecting poop samples from babies and from parents, as well as milk samples if parents are providing milk, to look at the germs in babies' poop and how that predicts their outcomes. So if you're interested in participating, you can get my email address from Jenny, or I think it will be listed within the contents of the webinar. Thank you.
Thank you, Jessica and Nicolette. That was great. As we talked about, for all those parents that are going through our perinatal program here at McGee, all parents will be given all the information about both Jessica and Nicolette's project. Let me see if I can share my screen. So this is in case for parents. Let me just make it bigger. This is Nicolette's project as well. So if you want to get a hold of Nicolette, her email is here at the bottom, and she will also meet with parents sometimes when they come for the surgical visit as well. So you have many opportunities to meet both of them and learn more about breastfeeding and the different options they have at Children's. So now we are going to move to our occupational therapist, Jamie, who many people will meet on the floors. And here, let me get this project up for her. So We'll talk about, she'll sort of talk to you about the things that occupational therapists do here at Children's. And I think it's just really important as we talk about in fetal clinic, the importance of feeding and how it can be difficult. Everyone feels like the hardest part is the surgery and getting through that. But I think in my experience, sometimes the feeding can be more challenging than the surgery or the post-op healing part. So feeding is a huge importance for our little congenital heart disease babies. So I think it's fantastic that we have Jamie here to sort of talk to us more about what occupational therapy does and the importance of them. So when they come to your room, you know not to shoo them away. You want them to come and help you. They're very important. So go ahead, Jamie, you can start. And just tell me when to move your slides.
Perfect. So thank you so much, Jenny, for letting me speak today. Yes, as Jenny said, occupational therapy is one of the many services here. Go ahead and you can move on, Jenny. One of the many wonderful rehab services here at Children's Hospital of Pittsburgh. OT, or occupational therapy, is a branch of the rehab services that provides assessments and interventions that allow your child to participate in their activities of daily living or their occupations. And of course, one of their occupations is feeding. So that's how we're involved with the feeding team. But go ahead and move on. Some of your other baby's jobs are just growing, not only eating, learning how to breastfeed or bottle feed, but also digesting food, breathing comfortably, having good bowel movements, getting enough strength and endurance to participate in their feeding. A baby's other jobs are bonding with their family, engaging in their environment, and that sets their groundwork for future social and emotional skills. So that's super important. Other developmental milestones that the babies will achieve during their inpatient or during their stay is being on their belly, lifting their head, tolerating being in an upright position, moving their arms and legs. So all of these are jobs that babies have to achieve. And to do that, they have to get what is called self-regulation. So you can move on. So what is a baby's self-regulation? Basically, that's just their ability to cope with stress, to maintain a calm and alert state, to participate in things like feeding. Self-regulation helps them buffer the effects of like negative exposures or experiences. And that is not just important for them now, but as a toddler, as a teenager, and as an adult. Okay, move on. So unfortunately, in a hospital setting, there are going to be disruptions to a baby's typical development in their trajectory. So some of the bad things that they can encounter are bad smells to medicines, alcohol, hand sanitizer, bright lights, procedure lights, tastes of medicine, suctioning, lines that could be pulling them, scary sounds or voices, basically anything that causes them to stay in a fight or flight response. Move on. But so if your baby is the baby to the left, who isn't exposed to stress, they spend all of that time in the purple, learning the green, engaging in their environment, and very little time is spent trying to cope or survive with stressful events. The baby to the right, that baby is spending more time in the fight or flight state. They have to spend energy and time calming to stressful events. And so they have less time to kind of grow and engage in their environment. But the good thing is our job as occupational therapists is to help them learn how to engage and how to cope with these stressful events. Next. So how do we do this? There are techniques on this slide. There's many ways to help your baby learn how to calm down. And the most important person that can do this is the family and the bedside caregivers. So there's a lot of things you can do. You can hold your baby, give them containment. You can encourage them to grasp your finger. So in occupational therapy, we will teach parents how to parent in this new and strange environment. So there's a lot of power that families have at the bedside. And so if your baby is calm and alert, then they can develop and they can participate in feeding. Next slide. So oral motor skills and pre-feeding skills are a big focus in occupational therapy, and speech therapy as well. And a lot of people say practice makes perfect, but honestly, it's perfect practice. So you want to make sure that everything that your baby is exposed to is positive, because it creates a memory for them. So offering positive oral stimulation can help reduce the sensitivities that can develop after procedures. And it's important to provide stimulation to the baby, with the baby and not to the baby. So they need to be an active participant in all kind of oral stimulation. So one tip is offering stimulation, whether it's the breast or the pacifier, to the lips first, and kind of allowing the baby to root and accept that stimulation. Next. So why is the pacifier so important? A lot of people, sometimes they can be hesitant to offer a pacifier, especially if they intend to breastfeed. But in this population, sometimes getting that non-nutritive suck, that can help them kind of modulate their pain or stress. So sometimes the pacifier is important for the first step for feeding. A lot of research shows that a non-nutritive suck encourages more calm and alert states. It helps their vital stability. It helps with their digestion and strengthening the muscles and the muscle tone around the mouth. It can help them swallow their secretions. So if there's a delay in initiating feeding, they can kind of practice those pre-feeding skills. And a lot of research says that oral stimulation leads to a faster transition to oral feeds. Next. A lot of times we find various types of pacifiers with a lot of different sizes and shapes. A lot of times it can kind of confuse their oral cavity, especially if they're not starting feeding for a while. So we do like the round pacifiers that are more similar to the bottle or the breast. A lot of times if you have a flat or very bulbous shape, it strengthens different muscle groups in the mouth. And so then when you go to try something more round, it's really difficult, or sometimes they develop like a hypersensitive gag reflex. So a lot of times we will recommend the green Soothie pacifier. Next. These next two slides are just some exercises that we offer in occupational therapy. So you might see that. And again, just to reinforce that all oral experiences should be as positive as possible, and that this is their exercise to prepare them for oral feedings. So we will teach you in occupational therapy and in speech therapy how to provide this kind of stimulation. In addition to OT and speech, lactation and nutrition are involved in our feeding team here. So we will support you in any way possible. And even if your baby's not feeding yet, we will support you in your pre-feeding skills.
Jamie, thank you so much for those tips, and so parents can know what to look forward to when they're in the hospital, especially with a newborn. So we really appreciate your lecture, and everyone, thank you so much for your time today. As we said before, feeding is probably, is very important to our congenital heart disease patients. We need them to grow and develop. So thank you, everyone. And we look forward to the next webinar. Everyone have a nice day.